Good evening, and thank you for joining us on this special show on cancer care powered by Roche. I'm your host, Anisha Nair Dhawan. October is observed world over as Breast Cancer Awareness Month, and the topic of our show today is prevention, tips, and treatment options. Awareness is a key to conquering breast cancer. Every 4 minutes, one woman is diagnosed with breast cancer in India. Every 8 minutes, one woman dies of breast cancer in India. It is believed that 50% of Indian women present themselves for treatment in stage 3 and stage 4 of breast cancer. This perhaps partly explains why post cancer survival for women with breast cancer is only about 60% in India as compared to 80 to 90% in the Western countries. Lack of knowledge and ignorance is the key reason for late diagnosis of breast cancer. Today, we have an expert joining us who will explain all aspects of breast cancer and the proactive steps we can take to catch it early and improve our chance of cure and a better life. Please welcome Dr. Vineet Govinda Gupta, Senior Consultant, Medical Oncology, Artemis Hospital. Welcome to the show, Dr. Gupta.
Thanks for having me, Anisha. Thanks a lot.
Dr. Gupta has studied and worked at All India Institute of Medical Sciences, AIMS, Delhi for over 12 years. He has won numerous awards, including the coveted AIMS Gold Medal for Best Outgoing Medical Oncologist and many other national and international awards. So, Dr. Gupta, let's get started. Now, breast cancer is the number one cancer amongst women in India. What are the reasons why a woman might develop breast cancer?
So yeah, Anisha, actually it is a cancer which has been rising fast. If you go back few years, cervical cancer used to be number one, but it has been falling and now breast cancer has become number one. And if you compare our country to Western country, their incidence is even higher than ours. So actually, a lot of it has to do with changing demography. Older women get more breast cancer. The average age of the population in India has been increasing, so that is one major factor. Also, when we talk about breast cancer, another major risk factor is actually family history. So, women where they have multiple relatives who are having breast or ovarian cancer, they are more likely to develop breast cancer. And lot of hormonal lifestyle changes lead to an increased risk of breast cancer. So, for example, if woman has late birth of the child happens after the age of 35, or if a lady does not choose to have a child or does not choose to breastfeed the child, if the menopause is late or menarche is early, these hormonal risk factors are important culprit for increasing the risk of breast cancer. So as our population and lifestyle become more westernized, the incidence of breast cancer keeps on increasing.
All right. So, is it right to say that cancer is a Western disease? And since breast cancer is increasing in the world at an alarming pace, are there any practices, any things women can do that they follow in their daily life that reduces the risk of breast cancer? You said breastfeeding is one that will reduce the risk. Uh, how do I help, my family
So
history? Can I reduce my risk if I know my family history?
yeah, so definitely, I think the first important thing is that any lady who has a strong family history, who has multiple relatives having cancer, they should contact an oncologist to look for genetic testing because there was a time when genetic testing was very difficult to do and very costly. But nowadays it is reasonable, and if the family history is strong, they should consult an oncologist. Other than that, there is something called screening, meaning that before a lady develop any symptoms, she can do tests like mammography or examination of the breast, self-examination or examination by the doctor to look for small disease at an early stage. So generally, we recommended women who are over the age of 40 should undergo screening with things like mammography at 1 or 2 year interval to look for early breast lesions. So the implementation of screening in India is currently less, but the way breast cancer has been increasing, I think it will be part of our national program maybe in a few years. So in the meantime, ladies who are in that age group should think of undergoing breast cancer screening with mammography.
So you're saying if there is some family member who has ovarian or breast cancer, and this is my first relative, mother, masi, sister, etc.
Hmm.
after 40 I should go for mammogram. But in
No,
our
no.
country, so many
Uh,
women, younger women are also getting,
exactly.
cancer. So who is this genetic counseling for? And what are the
Okay.
repercussions of genetic counseling for familial breast cancer in younger women? For older women, who have a family history, perhaps the mammogram will work, the breasts are not so dense. So what about younger women who are now getting diagnosed with breast cancer who have a strong family history?
Absolutely. So you are right. Actually, so around 10% of breast cancer are genetic. They are inherited. There are defected genes which are inherited from the parents, and generally these women have breast cancer at younger age. The breast cancer might be bilateral, and they have more aggressive breast cancer. So, especially patients who have got strong family history, they should get themselves tested to see if they have any genetic mutation which might predispose them to breast cancer. And actually, for them, screening starts at a much younger age. If the
It is.
patient has a familial mutation, generally screening should start around the age of 25. So
Okay.
the screening process is very aggressive for these familial breast cancer patients.
Mm.
And so it is important once again that if the family history is strong, early oncologist consultation should be there without waiting for symptoms so that these syndromes can be caught in time.
All right. You spoke of testing and screening. Now, patients with a breast lump are generally very afraid. There are even, myths in our country that they're so afraid of a biopsy. They feel a lump, but they don't want to get a biopsy because they feel that a biopsy can cause the breast cancer to spread. Is this true? Is there any basis to this?
Actually, I will tell you, it is a very painful, it is a myth, first of all,
Mm,
that the fact that the thinking that biopsy करेंगे तो cancer फैल जाएगा, it is a very, very
mm,
common myth. And I will tell you, it is such a painful myth because lot of ladies feel their breast mass in the first stage. And what happens is that because they are so afraid of biopsy, the family and the patient do not do the required testing. And when actually the cancer becomes stage 3, stage 4, then they go to the doctor. And at that time, their cure rate is much lower and their outcome is poorer. Like you mentioned in the beginning, that in India, 50% of patients are stage 3, stage 4. I think this is an important cause actually, that people think that breast biopsy causes the spread of the cancer, while it is absolutely not true. Breast biopsy is absolutely safe. In fact, anywhere in the world, be it India, Europe, US, anywhere in the world, breast cancer is never treated without a biopsy. So, biopsy is an essential part of breast cancer treatment, and it does not cause any spread of cancer. It is not a dangerous procedure. It is just a very short 5 or 10 minute process to take a small piece of tumor from the breast, and it is absolutely safe.
Okay. So can you reiterate for everyone so that this myth is busted that getting a biopsy is not going to increase your cancer?
Absolutely. So it is something, I think it is one very important fact which should go out there, that biopsy is one of the safest procedures you can undergo in medicine. And definitely, a breast biopsy does not cause the spread of breast cancer. It is very rare. There are only very few cancer where biopsy causes spread, namely testicular cancer of men and ovarian cancer of women. These two
Right.
cancers, we are little hesitant with biopsy because at early stage it can cause spread. But almost all other cancer of the body, biopsy does not cause spread of cancer.
And a biopsy is a gold standard for diagnosis. Could it be safe?
Absolutely.
Could there be anything else that could diagnose conclusively that you have breast cancer without a biopsy?
So there are tests like FNAC, even that involves putting a needle into the tumor.
Mhm.
But FNAC does not actually give us the information we need to treat the
Okay.
cancer properly. So all the international guideline, be they American, European, or even the Indian guideline, they recommend the biopsy for the breast mass. Otherwise, in some cases, suppose the mass is very small, we can think of doing an FNAC, but majority, 99% of patients should undergo a biopsy.
All right. Now, there's also another myth in our country that breast cancer is a woman's disease, the disease of women. How often do we see cases of male breast cancer, and how is it different from female breast cancer?
Okay. So first of all, I think women are the most important patients when it comes to breast cancer. We should not undermine the importance of their struggle. But one group of patients who get marginalized is actually men with breast cancer. So it has to be remembered that even men can get breast cancer, although the risk is much lower than women. So only 1% of breast cancer are male breast cancer.
Mhm.
99% of breast cancer are female breast cancer. So there are some differences between female and male breast cancer. Major problem is the male breasts are small actually. So the tumor
Mhm.
spread very fast to involve the skin, involve the chest wall. Also, awareness is not there for male breast cancer. So what happens is commonly male breast cancer present in stage 3, stage 4. Because men usually, if they feel a lump, they don't think it is cancer. While women first thought which comes to their mind is maybe it is cancer.
The
Okay.
cancer.
So what happens is that poor men usually present in stage 3 or stage 4. Fortunately, the prognosis of male breast cancer is also equally good as for female breast cancer. But because of late presentation, usually the patient present at an advanced stage. Still, it is a very eminently curable cancer. One more thing is I talked about familial breast cancer. It is
Mhm.
much more common in male breast cancer. So if there is even a single patient with male breast cancer, even if he has no family history, we always do genetic testing because gene defect is very common in male breast cancer.
Okay. And what is meant by stage one, stage two, stage three, and stage four breast cancer? What is the importance of staging and how does it impact the treatment?
Okay. So actually, when a patient come to us, the first thing we want to know is what kind of cancer it is and how much it is spread. So how much it is spread is what we mean by stage. So for example, if we talk about breast cancer, stage 1 is a very small tumor, usually less than 2 centimeter, which is only present in the breast and nowhere else. Stage 2 is tumor which is little bit larger, between 2 and 5 centimeter, or it has spread maybe to, it is a small tumor which spread to the lymph nodes in the underarm. Stage 3 is a basket. It is a larger group which contains locally advanced tumors. That is, which are tumors spread to the axilla, to the lower part of the neck, it's just inside the chest. So it is a local disease around the breast, but it is still not spread to any distant organ.
Hmm.
And stage 4 is disease which has spread to faraway organ like bone, liver, lung, or brain. So these are the most common organ where breast cancer spreads. So as the stage keeps increasing, the disease cure rate keeps going down and treatment becomes more difficult. So it is important that we should catch the disease as much as possible in stage 1, because more early we catch the disease, better the prognosis of the patient and less aggressive therapy the patient requires.
Right. So Dr. Gupta, what you've explained to us by means the stage one, stage two, stage three, stage four is perhaps, for the doctor treating us, for you to decide your treatment course. But for any woman who has, breast cancer, what does it mean to be in stage one, stage two, stage three, or stage four? Can she feel a lump in stage one, or is it too small? What is breast cancer when I'm in stage three? Will I have pain in other parts of my body or in my chest? So, for the patient undergoing this,
Okay.
can they tell that, okay, I'm in this stage or maybe something is wrong?
Actually, what we recommend is that if the at the first sign of trouble, even if patient just feel a small lump in the breast, they
Hmm.
should immediately, rush to a doctor, because it is best to catch the disease early. But typically, the signs of stage 1 cancer is lump in the breast. If it is a very small lump, less than 2 centimeter, it might be stage 1. As the stage progresses, the patient might be able to feel lymph node in the underarm area. So when the patient start feeling lumps in the underarm area,
Hmm.
usually it points to stage 2 or stage 3 cancer. And
Okay.
stage 4 cancer usually presents with symptoms like, if the liver get involved, they might have jaundice or abdominal pain. If the bones get involved, they might have bone pain. If the lungs get involved, they might have blood in sputum, and etc. So they have symptoms at sites other than the breast points
Hmm.
towards stage 4. Okay. But ideally, usually, what we see is that it is unusual that patient has no symptom in the breast and only the stage 4 symptom. So if the patients are vigilant about their symptoms, usually it is very easy
It's
to
caught
catch the
early.
patient in the early stage. So
Okay.
ideally, the goal should not be that we catch the disease in stage 4. Ideally, goal should be in every patient to catch it at stage 1 and stage 2 wherever possible.
Right. So you're saying that even in stage one, you can feel lumps and then go to hospital and
So,
get
so the
early
problem is
treatment.
actually the stage 1 lumps are very small, and
Mm. So
if the
can you feel
patient,
it yourself?
it might be tough to feel a 2 centimeter lump in the breast, because the breasts are normally also little bit nodular. because
Yes.
of fat in the breast. So patient may not realize that there is a small lump, which is why we do mammography actually. The reason for advising mammography after the age of 40 is to catch these very small lumps which cannot be felt actually. So that is why we suggest annual mammography to catch these small foci of disease. That is our goal.
Are you saying that usually stage one cancer is generally caught by a mammography, and that's why you see stage one, two cancers more often in the West than in India, where we are using more of self-examination or clinical breast examination, which you can only feel perhaps at a later stage. Is that a
You are
hypothesis, or
absolutely
could it be
right.
true?
You are absolutely right. The because screening programs are very well developed in rich countries and Western countries, they are catching many more patients at stage one. Because see, if the woman is undergoing a mammogram every year, to the usually what happens is even before the cancer develops, the
Hmm.
pre-cancer lesion might be caught by a mammogram. So definitely, you are absolutely right. The establishment of good screening programs is responsible for catching more patient at early stage in Western countries. You are right.
All right. Dr. Gupta, for a woman who has been diagnosed with breast cancer, is it mandatory? Is it a given that she will lose her breast because of surgery?
So actually, see, definitely no woman want to lose her breast, and as a doctor, we also don't want to uh, do this kind of problem to any lady. So thankfully, majority of patient nowadays, almost majority of stage one and stage two, and even a large proportion of stage three patient, actually they can preserve their breast. There is new technology called breast conservation surgery, where you can only remove the tumor and leave the rest of the breast intact. So the net result is that a woman can preserve her natural breast. Unfortunately, in some advanced stage, the women do have to lose their breast. But even in that case, a lot of new surgical techniques are there which can reconstruct a breast for the lady, which looks cosmetically like a normal breast. I know it is not a replacement for a real breast, but at least from cosmetic point of view, it looks very realistic. So, lot of options are there for women nowadays, and every majority of women actually can get away without losing their breast. Hello.
Right, right.
Yeah, yeah,
So, Dr. Gupta, you're talking about conservation
absolutely.
surgery, and that has really changed the lives of many women who have undergone breast cancer treatment. Now, the next question that comes is: does every woman who develops breast cancer need chemotherapy? Is there a way that they can be treated and avoid the side effects of chemotherapy?
Okay. So I think it is very important question, and it is the heart of. So I am a medical oncologist. My main job is treating cancer with medicines, and the heart of clinical research over last 10 years has
Hmm.
been how to identify women who don't need chemotherapy. If you go back maybe 7 8 years, the trend was that any tumor more than 1 centimeter, chemotherapy used to be given. But things have changed actually. Nowadays, actually, there are a lot of genetic studies and tests which can be done. Suppose patient undergoes surgery and it's a small tumor or a low risk tumor, which is not a fast growing tumor. There are a lot of tests available which can be done where you can take out the DNA of the tumor and look to check whether patient actually need chemotherapy or not. And in the current era, actually, if you look at the latest studies, it is only around maybe 20 to 30% of patients who actually
Hmm.
need chemotherapy. Mainly, it is the patient who are stage 3 or higher or who have adverse genetic features who are requiring chemotherapy, while most of the other patients can be treated very easily without chemotherapy. So every year, I will tell you, the number of patients who need chemotherapy is actually going down as the data becomes more and more refined. So I think in the very near future, the number will fall even more. From 30% now, probably it might fall to 10 or 5%. So a lot of work and lot of research is going on to identify actually which patient benefit from chemo and which
Hmm.
patient get no benefit from chemo. So that is the direction we are going in. And at present, as of 2021, I can tell you that not more than 30% or so patient actually need chemo after surgery. While locally advanced patient, of course, they do need chemo still.
Okay. So that's good news that if you can avoid chemotherapy, then you will avoid the toxic side
Side
effects
effects.
as well. Now, traditionally, the way breast cancer is treated, you either have chemotherapy, reduce the size of tumor, then get a surgery, then have perhaps subsequent chemotherapy and radiotherapy. But now you're saying that only 30% women may actually benefit from chemotherapy. So, what are the new treatments that are available for breast cancer? You don't want to undertreat the patient, right?
Absolutely. So the reason the thrust on chemotherapy is less actually is that a lot of new therapies are available which actually work by different mechanisms. So there are three main therapies which have made very strong steps forward in breast cancer. One is called hormone therapy, one is called targeted therapy, and one is called immunotherapy. So basically, what these three therapies have done is with very low side effects, they have very strong benefits. So the net result is they have replaced chemotherapy in a lot of patients. And due to this is the main reason why majority of patients nowadays don't need chemotherapy.
Okay, but do they have as good effects? Are they as effective as what chemotherapy is supposed or believed to be for treating cancer? Do these work as well, the hormonal treatment or targeted treatment or even the immunotherapy?
Absolutely. So I will give you an example. Okay. Suppose there is a lock on the door. Now you can either break the lock open with a hammer or you can put a key in the lock and open the door. So
The easier way.
chemotherapy is like the hammer actually, meaning you are
Okay.
because you don't have anything better, you are basically just using drugs which directly kill the cancer cells, and they have their own set of side effects. But hormone therapy, targeted therapy, immunotherapy, they are therapies which are very customized to the tumor cell. So they are like a
Okay.
key to each tumor cell. You test whether the therapy will work in the cancer or not, and you use the key to open the lock. So because of
Okay.
that, they don't have a lot of impact on normal cells of the body, and they don't have a lot of side effects. But because they are the key to that particular tumor, they have very good impact on the tumor. Actually, in each particular tumor subtype, they work very well, as good or better than chemotherapy. So that is the
Okay.
reason why chemotherapy is going down.
Okay. So let's talk about these three different types of treatments now. You mentioned hormone therapy. What is this therapy? Does it involve intravenous drugs? And who does this work for?
Okay. So actually, see, breast cancer is a hormonal tumor. I mentioned in the
Hmm.
beginning that patient where the
Is it
hormonal
always
system is
a
not
is
working
it
well.
always a hormonal tumor?
No, no. So in around 70% of patients, the breast cancer is driven by the hormone system. So when we do the biopsy, we test the biopsy to see what kind of tumor it is. So hormone therapy is generally given in the form of tablets, but some hormone therapy are injectable also. And the basic idea is that you manipulate the hormone system. So females have hormone like estrogen and progesterone.
Hmm.
So by giving those tablets, you can manipulate the level of estrogen and the way these hormones work, and they help in preventing the growth and spread of the tumor. So if you use it in the right patient, they are very, very effective treatments with almost zero side effects. So there are some hormonal side effects, hot flushes, little bit of
Hmm.
mood changes, little bit of tiredness in some patient. But many of the most troublesome side effect of chemo, they are just not there in hormone therapy. And just simple tablets which the patient need to take every day. So they are quite good and effective therapies in the right patient.
That's amazing. Just oral tablets to perhaps treat 70% of breast cancer cases. That's great. Now, what is this targeted therapy and which patients do we use this targeted therapy for?
Okay. So there are number of different targeted therapies, but in interest of time, I will talk about the most common targeted therapy. So what targeted therapy is? The cancer cell is different from a normal cell. So when a normal cell become a cancer cell, lot of DNA changes happen, and what happens is that the cell changes and it acquires certain factors which can be identified by doing various tests which make it different. So targeted therapy is we give the patient medicine which work on that differential factor, which separates a normal cell from a cancer cell. And again, because it is only acting on the cancer cell, it is very effective with very low side effects. So the most common targeted therapy we use is something called HER2 targeted therapy. These are various tablets and injections which target a protein called HER2, and at least three or four generation of drugs are available, and they are very, very effective with very low side effects. So around 15 to 20% of patients have this protein called HER2. And in these patients, we use HER2 targeted therapy with very, very good response and almost negligible side effects.
Okay. And what about immunotherapy? Is there a role for immunotherapy for breast cancer treatment? Which are the patients who benefit from it?
Okay. So immunotherapy is actually a very new and exciting frontier of medical oncology. So what has been understood in last, actually Nobel Prize was given for immunotherapy discovery in cancer, and this field has been expanding rapidly over last 4 years. So what was found is that actually that the normal immune system of the body is also able to kill cancer cell very effectively. And now there are drugs and medicine available which can improve the interaction between the immune system and the cancer cell. So the immune system which is not able to kill the cancer cell, you can give medicine so that it becomes active and able to kill the cancer cell. So the role of immunotherapy in breast cancer is being developed. Currently, the main role is in a type of breast cancer called triple negative breast cancer. So these are patients which are negative for hormone therapy and negative for targeted therapy. And in these patients, actually immunotherapy has shown good benefit in a subset of patients, not in every patient. So a lot of research is going on. In last 2 years alone, two or three drugs have come up and they have achieved approval. So this is probably a future-facing therapy which will show a increasing role over the next 2 or 3 years. Already we are using
Okay.
it in triple negative breast cancer, but the role need to be better characterized with more research. So that work is still
Okay.
going on, and mainly at present we use it in this one subtype of breast cancer, which is around 10 to 15% of patients.
Okay. And more research is being done. Let's hope we get more advances in immunotherapy and a
Absolutely.
larger subset of women can be treated where your own immune system is helping you fight the cancer. Now, Dr. Gupta, I've heard that the prognosis of stage 4 cancer is very poor. Is it true that patients only live for a few months? How can we give them some more time or give them a better fighting chance to battle this?
So actually, this is also unfortunately one big myth, and we have been fighting against this myth for a long time. That patient, one some there might be some doctor who says कि इनको stage 4 breast cancer है, कुछ नहीं कर सकते, घर ले जाओ. But I will tell you, with all these new therapies, the survival of stage 4 breast cancer, it is massive. Actually, if you look at the newest data, in stage 4 breast cancer as of 2021, the average survival, the average, which is median, it is easily 4 to 5 years. So even a patient where the cancer has spread to lung, liver, bone, brain, if they are able to access the latest therapies, they can get very, very, very long survival. And I will tell you, we have so many patients with stage 4 breast cancer who were diagnosed in 2015, 2014, 2013, who are still alive and very healthy. So it is a major myth which needs to be broken down. Just because patient has stage 4 breast cancer does not mean that they are doomed to, only few months of life. If they are able to get the right treatment, survival is very long. The only thing which is important is the right key for the right lock. If the patient can get the right key for their lock, the survival is very good. Just throwing a hammer on the lock will not give you good survival. If you are able to find the right key for the right lock, that will give you good survival.
Right. Dr. Gupta, we're coming towards the close of the show, and we've, tried to bust many of the myths associated with breast cancer. There's also a fear attached to breast cancer and some sort of stigma that women feel that, I will not be loved, self-image, and, and many other issues. So, what would you like to say as a last word about this fear of cancer? Because now medicine is very full of progress and the stigma that some women believe that we should not talk about it, our girls will get affected. So what would you say?
Okay. So I think it is a very important question. What happens many times is that we get lost in all the medicine and drugs and surgery, and we forget that at the center there is a human being who is the person who is actually dealing with the worst battle of their life. So actually, a lot of support is required. I think most important support patient can get is one from their family and two from their doctor. But the both the family and the doctor and the patient, they need to unite together as part of a team. In addition, there are a lot of resources available nowadays which can help patients. There are patient advocacy groups, that is, groups of patients which have already gone through their battle. And it is a sisterhood. They are able to guide the patient better how to move forward because they have gone through that struggle. They know how to handle all the challenges and they can help the patient. There are counselors, including genetic counselor, patient care counselors, which can help the patient. And there are a lot of rehabilitation tools, be it care of the hair loss for the patient who need chemotherapy, care of the side effects, help with the breast prosthesis, psychological support. A lot of things are there which are part of the treatment journey. And I think since patient does not have access to all these things, it is important that the oncologist connect the patient to these resources so that they can fight their battle in the best possible way. And once again, I want to reiterate that due to the very good prognosis in the current era, every patient with breast cancer, I always tell them, be hopeful. You have, even in the worst case scenario, you have years of survival. So it is a time of great optimism, and patients should be very hopeful.
Very quickly, Dr. Gupta, what's your view on clinical trials? Is there any benefit or is the risk for cancer patients if they join a clinical trial?
Actually, I will tell you, we are very lucky nowadays that we now have a lot of clinical trials available in our country. For example, at the moment, I have around 5 clinical trials just in breast cancer, which are running at my center. And I will tell you, patient who join the clinical trial, they have the best outcome. The reason is that not only do they get access to the best treatment which is available, they are able to access experimental therapies which normally there is no way to access. So all the things we have discussed so far, hormone therapy, targeted therapy, immunotherapy, they have come because of clinical trials. So if right now they are available in the market, but 5 years back they may not have been available, and only a patient who was part of clinical trial could access these therapies. So always, whenever I get a patient with breast cancer, and we have a clinical trial available for the patient, I always suggest the patient to go for clinical trial. The one more advantage of clinical trial is treatment is free. So any patient to join a clinical trial, the treatment is absolutely free. So not only they get the best treatment in the world, but they get it free of cost. The only disadvantage might be that sometimes the patient is getting a new therapy, so they may have some unexpected side effect or problem. But most of the clinical trial are under supervision of Drug Controller General of India, various ethical committees, as well as the oncologist. So severe side effect, even if they happen, usually they are managed quite effectively. And overall, my experience with trials has been very good. So mostly I tend to offer patient clinical trial whenever they are available with the pros and cons. And personally, if suppose Bhagwan na kare, one of my family member get this problem, I will definitely want to enroll them in a clinical trial if it is available.
All right. Dr. Gupta, thank you so much for joining us today and sharing so many details and information about breast cancer. I'm sure all our viewers have benefited from all the information they've got. And what you said about, how supportive cancer care is through medical advancements, through support groups. Nobody should be afraid of being diagnosed with breast cancer because the outcomes these days are very good. Thank you so much for joining us.
Thank you, Alicia. Thanks a lot.
Do follow us on Facebook to get all the updates on our upcoming programs. Till then, stay at home, stay safe. Goodbye and peace.